Everyone to the Thursday, November 18th media briefing with the Windsor-Essex County Health Unit. We'll jump right into the EPI presentation, and Ramsey D'Souza, our Manager of Epidemiology and Evaluation, will be presenting an EPI summary, and there are some new slides just to note for the group. All right, Ramsey, take it away.
Thank you, Mike. Hi, everyone. Thank you for joining us for this week's presentation. We'll jump right in terms of the usual order. As Mike mentioned, there are a couple of new slides pertaining to the vaccine status of our cases, but we'll go into more depth as we move along our presentation. So let's begin. So we'll start off by talking about our cases in Canada as a whole, what's happening in Ontario, and wrap up with what we're seeing locally in Windsor-Essex. Looking at what's happening in Canada as a whole, our cases in the province or in the country has been slightly increasing, though it has stagnated as well in the past week. In terms of the current 7-day average for Canada as a whole, the most recent 7-day average is about 2,500 cases. This time last week, we were at 2,400 cases, so a slight increase, but overall cases have stagnated in terms of its growth. When we look at what's happening in Ontario, it tells a different picture. We are seeing an increase in cases in the province. The current 7-day average is about 580 cases a day. This has increased from last week where we were at 490 cases per day. Now, locally in Windsor-Essex, especially in the past couple of weeks, we have seen an increase in our case counts with some minor fluctuations day over day. Our current 7-day average, we're seeing about 36 cases a day, whereas this time last week, we were seeing about 20 cases a day. So almost a twofold jump. When we look at our rates for each week, if you look at our most recent completed week, which is week 45, our rate has increased and it currently sits at 59.0 cases per 100,000 population, where this time last week we were at 33 cases per 100,000 population. Once again, almost a twofold jump. And in the most recent 7 days, our rate sits at 64 cases per 100,000 population. And once again, in the past week at this time, we were at 34.9 cases. So almost over a twofold jump at this point. So how do we compare looking at a weekly rates to other regions in the province and the province as a whole? Overall, we are seeing an increase in the province and also in the southwest region of Ontario, though our increase is a bit more dramatic in terms of what we're seeing. When we look at the most recent completed week by each PHU from November 7th to November 13th, while our rates have increased, there have been other regions in the province, especially in the northern health units, such as Sudbury and in Algoma, where the rates have been a bit higher than ours. Now, revisiting our wastewater surveillance data, beginning in the month of November, we did see an increase in terms of our wastewater surveillance, indicating an increase in COVID-19 cases potentially. Though it has decreased, levels are still high to what we were seeing towards the beginning of October and for most of October. When we look at our tests and our percent positivity for those tests completed for COVID-19, for our most recent completed week, our percent positivity is 4.3%. This has increased slightly from where we were last week, where we were at 3%. Though it has increased, we're not at the stage where we were at during our fourth wave, where our rates were close to 8%, 9% at that time, though it is currently increasing currently. Once again, so looking at our comparisons to other PHUs in the province, while our percent positivity is high, there are other PHUs in the province that are experiencing an increase in burden of illness tied to COVID-19, such as those in southwestern Ontario, in Sudbury, and also in Halsman, Norfolk. So breaking down our percent positivity using the 7-day average by age group locally in Windsor-Essex, if you look at all of our lines in the most recent week or so, across all of our age groups, our percent positivity is increasing. This is especially true among those in the 0 to 17 age group, which is the dark blue line, and at 35 to 64 age group, which is the gray line. The percent positivity for the most recent percent positivity for those two age groups is at 4.9%. Now looking at our case rates by municipality for November onwards, the top three highest case rates were in Leamington, Tecumseh, and in the town of Essex. When we look to break down our data for the most recent 30 days, strictly looking at the distribution of the cases by municipality, under 50% of our cases are coming from Windsor, though 13% of our cases are coming from Leamington and 8% from Essex and Tecumseh each. Usually, for most of the pandemic, we've seen over 50% of our cases or higher coming from Windsor, but in the recent past, we have seen a better distribution of our cases across our other municipalities locally. In our most recent 7 days, 53% of our cases are from Windsor, 11% from Leamington, and 10% from Tecumseh. Now looking at our overall age and sex distribution of our cases, just as how we've seen in the past few weeks or so, most of our cases, about 21% of our cases, are coming from those 0 to 19 years of age, whereas cumulatively for this age group, we should be seeing about 15% of our cases if we were to look at the entire pandemic as a whole. There are some other age groups as well, especially in the 40 to 49 and 60 to 69, where we are seeing a slight increase, which we'll continue to monitor to see where those cases are coming from and what the context is of those cases. When we break down how our cases are acquiring COVID-19 from November onwards, we see that approximately 34% of our cases are acquiring COVID from the community through an unknown source, and just under 25% each from a household contact or a close contact. When we look at our school-age cases specifically, while we did see a decrease in the months of October, we are seeing an increase once again in November, where our current 7-day average has actually doubled from where we were last week, from 3 cases a day to 6 cases a day. Likewise, when we compare the trends between our overall 7-day average to our school case or school age cases, we are seeing an increase in both, though it is a bit more pronounced in our school age children. So looking at our hospitalizations in Ontario and in Windsor-Essex, hospitalizations in Ontario have stabilized with some fluctuations observed. In Windsor-Essex, however, we are seeing an increase in our hospitalizations for COVID-19 in the most recent 7 days. In the entire province and in Windsor-Essex, our ICU admissions have remained fairly stable since mid-October, with incremental declines observed over that period of time. So this is a new slide. This slide looks at our most recent completed week's worth of vaccination data for our cases. In terms of our cases, over 50% of our cases were fully protected. 44% were unvaccinated, and also in instances where we did not know the status of our cases, they were also grouped together in that group. 6% were partially protected. These are individuals where they have 1 dose of the vaccine and acquired COVID-19 after 14 days from their first dose. There were 0 cases that were not yet protected. This category is defined by those that received either 1 dose of the vaccine and acquired COVID-19 within 14 days, or received a 2nd dose of the vaccine and were also within that 14-day time frame. So when we look at all of our COVID-19 patients who are currently hospitalized in the past full week, 57% of our cases were unvaccinated, 4% were partially vaccinated, and 39% were fully vaccinated. When we look at our ICU cases in the most recent completed week, 86% of our cases were unvaccinated, and 14% of our cases were fully vaccinated. Now moving on to our doubling time. In Canada, our doubling time has stagnated due to minor increases observed in the country as a whole. In Ontario, we are seeing a decline in our doubling time, highlighting an increase in cases in the province. The same can be true for Windsor-Essex. When we look at our most recent median R0, it currently sits at 1.3. When the R0 is greater than 1, it means that each new infection leads to one new infection, signaling that our case counts are increasing in our region. So moving on to the vaccine side of COVID-19. Looking at the number of doses administered from October onwards, we have seen an increase in dose administration locally, but this is primarily driven by our third dose booster shots, where eligibility has opened up in the past couple of weeks. When we look at all doses from October onwards administered to our residents locally in Windsor-Essex, our current 7-day average for number of doses administered is at 835. As if you look at the green line, it is trending upwards. And once again, this is primarily driven by our third doses that we're administering locally. Now looking at our coverage rates for overall in our region, as well as those 12 plus and 18 plus with at least one dose administered. We are overall for all of our residents, even those that are not eligible, almost 76% of our residents have received at least one dose. There is still room for improvement in some of our younger age groups where we can get those rates higher. But if you're looking at for those 12 plus, our coverage rates for at least one dose sits at 86.3%. Now looking at our fully vaccinated population, just under 73% of the entire population, including those that are not eligible for the vaccine, we have an overall coverage rate of 73%. Once again, just like in the last slide with at least one dose coverage, there is room for improvement, especially in our younger age populations. This slide looks at all of our vaccinations by FSA, which is our postal code, the first 3 digits of our postal code, where at least one dose was administered, and for all of our residents, including children who are not eligible for the vaccine. There are some regions in our community, such as the NOP, where there is room for improvement for our vaccine coverage, and the N9A postal codes, whereas overall we are seeing signs of improvement in our coverage rates. Just like in our last slide, for our fully vaccinated coverage by FSA, including those that are not eligible for the vaccine, it tells the exact same story, that while there are areas where we are doing well in our community, there are some regions as well where we can do better and increase our coverage rates. So how do we ourselves with other PHUs in the province? For our first dose coverage rates, we're moving closer and closer to the middle of the pack. We are still below the provincial coverage rate for at least one dose. When we look at our fully vaccinated coverage rates, if for our purposes, we are in the lower part section of our province, and we are also below the overall provincial coverage rate as well. So in summary, case rates have increased this past week. Our waste our wastewater surveillance data does highlight that we have seen a recent increase in our levels, though it has dipped in the past couple of days. We are seeing a disproportionately higher number of cases in children and youth, like we've observed in the past few weeks. While COVID-19 hospitalizations have increased and remained stable, ICU have increased. Sorry, ICU admissions have remained unchanged. The increase in dose administrations locally in Windsor-Essex currently is primarily driven by third dose booster shots. So looking at our monitoring indicators, for our most recent completed week, our weekly case rate sits at 59.0 cases per 100,000 population. For the most recent 7 days, that rate is 63.9 cases per 100,000 population. Our percent positivity for the most recent completed week is at 4.3%, whereas in the past 7 days, it sits at 3.8%. Our median R not effective is at 1.3, and outbreaks in the region currently remains high, currently sitting at 27 active outbreaks. Our coverage rate is above 86% for those 12 plus with at least one dose, and almost 83% for those fully vaccinated and those 12 plus. Thank you.
Ramsey,
Thank you,
before we go on, if you could just add one more comment, which is, I think you had stated that 86% of all the hospitalizations are in the unvaccinated population. Could you just share with us the population distribution between the vaccinated and unvaccinated?
Sorry, could you like 20? A bit more?
So if I interpret the data correctly, and you're the expert on the data, is that there were about 80 something percentage of the hospitalizations were among the unvaccinated. The unvaccinated only constitute about 20 something percent of the population. Is that right?
That's correct. So in the ICU, 86% of our cases are unvaccinated, and 14 are fully vaccinated. And we are seeing, we have about over 300,000, 214,000 people that are fully vaccinated, and about 30 to 40,000 individuals that aren't fully vaccinated. So that number is smaller, yet we're seeing more people in that population in the ICU.
Right. Right. So I guess my point would be that disproportionately, the unvaccinated constitute the largest burden to the healthcare system as it relates to caring for patients. Is that fair?
That's right.
Okay. Well, thank you.
Thank you, Ramsey. We'll jump into media questions now. Today we'll start with CBC.
Yes, good morning. I'd like to ask about the young person who recently died. Can you comment on what their vaccination status was?
You know, as a matter of policy, the Public Health Service doesn't comment on the details of any particular individual. So we can't really offer any further comments on any individual cases.
Okay, I understand that this is for privacy reasons, but can you explain how it's a privacy violation to disclose, details like the age of the deceased, whether they had any medical conditions? When last December, we had a situation where a 27-year-old man died, and details like that were disclosed at that time.
Yeah, I think these are complicated issues, right? Because as members of the media, we balance the interest of the people that we serve versus the privacy rights of the individuals versus what we think it might be a public health priority that's in some way modulated by how identifiable or not identifiable a person might be, and the number and the background number of cases. Also, there has been a transition in leadership, at least in the interim, to me serving as a medical officer of health. And I think that we all reflect back on what we think is the right balance between these competing interests. To me, the public health issue is the most important thing. It's not about the individual. The public health issue is that people are dying of COVID. And although most of the deaths are in people that are older, and perhaps living in residential facilities, COVID still is causing deaths among all spectrum of the age group. It is true that people who have comorbidity are more likely to succumb to COVID. I think that's a fair generalization. But as we can see from the data across the province, there are people that are community living, otherwise living an independent life, who succumb to COVID. So to me, that's the real public health priority and issue. But I recognize there's some area of disagreement or difference in perspective on this, and I appreciate that.
I also wanted to ask how the death was reflected in the provincial numbers before our local data. Do they get that kind of information sooner, or perhaps through a different process?
Yeah, I'm going to ask my colleagues to answer that question because I'm an expert on data abstraction. So
we enter, all information is entered through databases that are the public health unit has access to, but are also provincial databases. And this happens with lots of things that are reported by the province and reported by us. Sometimes there's a difference in the timing, between the cutoffs for which we decide to report or things that we're still investigating or reviewing. And so there are differences in reporting, and not just in this case, but in many cases that you've probably seen throughout the pandemic. And there are databases that are shared, certainly by the ministry. We have agreements with the ministry to have access to certain databases. Ramsey may want to add to my comment, but it's probably the simplest way to answer that question.
Nope, it's perfect.
Thanks very much.
Any questions from Blackburn?
I've got to go through all my notes here. Sorry. I wanted to ask you that, skip me and come back to me.
Okay.
Sorry.
We'll go to the Windsor Star.
Yes, good morning, everyone. Ramsey, thank you very much for your presentation. This may be more of a question for Dr. Nisbet. Looking at the vaccination status of recent cases, it looks like fully vaccinated and unvaccinated individuals are representing a very similar number of cases or proportion of cases. What would you say to residents who see this data and think, well, vaccinated or unvaccinated, I might be equally likely to catch COVID looking at those numbers?
Yeah, so that was what I was trying to perhaps try to highlight. The number of people, the denominator, the number of people who are unvaccinated is smaller, substantially smaller than the number of people who are vaccinated. And yet the smaller group of people represents many multiples of the number of cases. So your risk, any individual's risk of being hospitalized and dying is much greater if you're unvaccinated than if you're vaccinated. And that's not a Windsor-Essex phenomenon. That's the thing what the data would bear out throughout multiple jurisdictions. So thinking that only 20%, I think that right now, 82%, Ramsey? We can give you the exact number, but I think 82% of people in the health district are vaccinated, and they constitute a minority of the people being hospitalized. I think they're 14%, whereas the 20% who are unvaccinated constitute, I think 86%. So it's if those are the numbers, it's many multiples, 5, 6. But we can give you, maybe I could ask Ramsey if you could maybe speak to that and then maybe follow that up with an email or something of that nature, if you're comfortable.
I think one of the pieces too is our rate for unvaccinated is at 330 cases per 100,000 population, whereas those in fully vaccinated is at 95. So that's 3 to 4 times higher. I think that speaks volume to, yes, even if you're fully vaccinated, you can acquire COVID-19, but this is especially true if you're unvaccinated.
And one important piece to note as well is, I think, which Dr. Nisbet said, is the impact. So those who are fully vaccinated, if they do acquire COVID, the likelihood of them becoming severely ill and hospitalized is a key component, as well as their ability to transmit to others. So we know they're less likely to transmit to others. So, those are really important points that aren't always captured either.
Yeah, this is an important point. I'm sorry to belabor this. There are two separate issues. There's one is when you get vaccinated, you help yourself because you're less likely to get sick. And the data shows that in Windsor-Essex, like in every other place in the province. And secondly, if you do get sick, if you're vaccinated, you're less likely to be hospitalized and die. Secondly, if you get vaccinated, you help other people because, among other things, is that if you're vaccinated, you're less likely to get infected, and if you don't get infected, you can't transmit the disease to anybody else. Also, when hospital beds are occupied by people who have COVID, which is for the most part, that's a preventable phenomenon. That means that other people who need ICU beds can't get treatment. And sometimes you need to have an ICU bed available because you have to book an elective surgery or an emergent surgery. So not only is our COVID cases using healthcare resources, but they're affecting the health services of other people who don't have COVID. And in a health system that's already strained by volume challenges and access challenges, this only exacerbates an important public health challenge as it relates to providing basic medical care for people. Sorry we were so long-winded on that, colleagues.
I appreciate the in-depth responses as an example of how one data point carries a lot of weight and requires a lot of context. So thank you for the explanations.
Any questions from AM 800?
Ramsey, I just want to make sure I heard this right. Excuse me. Did you say there is 30 to 40,000 still not fully vaccinated?
Sorry, that number is actually higher. It's at 51,000 individuals.
So we're at 51,000 individuals right now that are not fully vaccinated.
Yes.
Okay. And I guess just to the point, just for let the public know, when you mentioned the 3 municipalities that are the highest the past week, they live in those municipalities. They didn't get infected in those municipalities. Is that correct?
That's right. That's correct.
Okay, yeah, that's it for now. Thank you.
Yeah, that's actually an excellent point as well. And this is one more reason we always try to provide context. Where you live is not necessarily where you transmit, where you acquire the illness or where you transmit the illness. For people that work, they spend more hours many times in where they work or on their way to work and on the way home than actually in where their geographic location is. So as interesting as it is to know where people live, where they sleep at night, it's also important to know that this is a number that you have to think in to where transmission may or may not be.
Thank you.
We'll go with CTV.
Yes, good morning. If the burden of COVID continues to worsen, would you consider additional restrictions for the region, and what would the threshold be for those?
Well, we always keep every option open in trying to contain COVID-19. Again, I'm sorry for this long-winded answer. The first is that the province has a framework to act on the burden of disease across the province. And as we've seen, the province in the past has promulgated certain rules or enacted greater restrictions, and in other cases withdrawn restrictions based on the assessment of risk. Ontario is divided into 34 autonomous health districts. The legislature had envisioned that there would be a modulation or an adjustment in public health approaches based on local factors. And if there are factors that make Windsor-Essex disproportionate, then I think Windsor-Essex would probably have to consider additional restrictions beyond what the province might do. And it has done so in the past. The one thing that concerns me is that young people have been disproportionately affected by COVID, especially children in elementary schools. And I think that we should do everything that we can to keep public schools open, which is one of the reasons we really share with families that if their children are sick, keep them at home. If your children are eligible for vaccine, get them vaccinated. And so I think that it's not inconceivable that there might be additional restrictions based on case counts, and Windsor-Essex, like all other health districts, leaves the option open for additional measures as the epidemiology would warrant.
Okay, thank you. And are you concerned with the removal of PCR tests returning to Canada for travelers, especially with COVID cases surging more in Michigan right now?
Well, the federal authority manages the process related to the border, and I think that it would be worthwhile to ask them to comment on the scientific basis for that judgment to place the testing program and then to withdraw the testing program. You know, as a generic construct, one has to think about what is the goal of testing. It's actually more, you know, in clinical medicine, it's not always the best thing to order a test. And so you have to make a strategic decision. And that's also true in public health practice based on your epidemiology and your goals. But I think that the federal authority would be in the best position to comment on that question, which is a very fair question, I might add.
Okay, thank you.
Sorry, I was on mute. Are there additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
Yes, I wanted to ask about the acquisition slide. We have 23.4% of cases in the last week that have been infected with close contact with a previously confirmed case. 24.9% were household contacts. 33.5% were infected in the community. It's higher. I have to wonder, are you concerned about community transmission? And at what point do you decide that maybe we need more restrictions in the community to control community transmission specifically?
So Ramsey, maybe I could offer some comments and you could supplement them on a technical point of view. The determination of community acquisition means that we're not able to identify a clear a person-to-person transmission. Is that correct? Is that
That's correct.
the taxonomy? So at one level, it's more satisfying when someone has a communicable disease to know how they got it. And when you don't know how they got it, and I'm going to use the vernacular, then you are concerned. And as the people with transmission of unknown etiology or undetermined etiology increases, that is one signal of increased burden of disease. It's also, I would say, a signal of lack of control, or because you don't really know how to what the containment step for that individual case might be in a fulsome way. I think, though, that one has to consider all the data elements together to consider the burden of disease. And without being prescriptive, the burden of disease is the number of cases for sure, but also has other elements. The other elements would be the number of people who are actually hospitalized. And before that, the number of people who are sick, the number of people of those who are sick to go to the doctor, the number of people admitted to the hospital, the number admitted to the ICU, and the number who die. That would be like one spectrum of trying to look at those metrics. And then you want to look at more community metrics, like the number of school cohorts that are dismissed, the number of outbreaks that are currently active, the number of people who are self-isolating. And pulling that all together, one can make a judgment of burden of disease. The one thing about vaccination is that even for the same number of cases, the higher the vaccination rate, we can reasonably infer that the burden of disease is less because there are less people going to the hospital, less people being in the ICU. So In a long-winded way, I'd say it's more than one data element to make that to make the judgment. But definitely, we are concerned when we see an increase in what are termed community acquisitions.
Thank you very much.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from AM 800?
Just one in regards to the outbreaks. So Ramsey, you said, I believe, 27 active outbreaks right now. I'm looking at the website. I know the workplace and community outbreaks have been listed in the same category. I know I asked a similar question to this last week, but if there is a cluster, for example, and I know it happened last year at the arena complex and it went to schools, would the health unit announce at that time if there is a cluster, if there is a site and then another site at that time, would those locations be released to let the public know?
So I'll start, and Ramsey or Dr. Nisithuri can comment. So we do have a public exposure notification process. So where there is a risk to the public, and it's not, easy for us to, to identify all the members that potentially of the public that may have been exposed. When there is an exposure, you will see an identification there through our public exposure notification. So sometimes it can be twofold. We might list an outbreak as well. You may see a public exposure notification associated with that outbreak. Sometimes with an outbreak, there may be multiple locations that are affected from a public exposure perspective. And so it can be a little bit complicated, but I think what you're referring to, Rob, was last year when we reviewed some clusters, and part of that was around, education and sharing for the public, how some of these activities are intertwined and connected. And, it was really part of an education for the community or, to talk about things like community transmission and outside household transmission, and to really share and remind individuals about, risk and managing their own risk. But Ramsey might, or Dr. Nisithuri may want to add.
No, I was going to add to that second point. I think this time last year, we were still trying to understand COVID and how it spreads and how activities can lead to further transmission. So, we do continue to investigate all of our clusters and outbreaks internally. And if you're seeing trends and newer instances or unique instances that we would like the public to know and to share to bring more light to how COVID is spreading in our community, we will definitely look to share that.
The one thing I would add is this is something we're seeing as a signal right now, which is that we're seeing transmission from groups in schools to groups in athletic events to people grouping in parties or other recreational type. So the chain of transmission, school to athletic event to social event. And when we see these chains, that's when we start to get worried, because at a population health level, that suggests that it's one more signal of transmission. So we're seeing more outbreaks, but we're also being able to connect the outbreaks or the clusters together. And that has implications as we move into the holiday season. Is that having a holiday gathering is not without risk. And one has to think, what is the acceptable level of risk they have for them and their family members and other attendees moving forward. So anyway, I share that as a supplemental comment to your question.
Ramsey, just not sure. Obviously, 27 outbreaks. We don't want outbreaks, but 27, is that considered high in a region our size in Windsor-Essex?
That is really high. We've constantly seen 20 or more outbreaks for most of this fourth wave during our time. So it is really high. It continues to be high. I think, for me, I think even over 10 outbreaks are high for a region, and so we're pushing that threshold for what is considered high each time, yet also adapting to that threshold as we move on.
Thank you very much.
Any additional questions from CTV?
Yes, just one. I know you said that the province and the health unit can sometimes report the deaths at different times, but I'm just wondering, so the death of the person under 20, will that be reflected on the health unit's website today then?
Yeah.
Okay, great, thank you.
Okay, that's the end or the conclusion of our media briefing for today. We'll see you all on Monday, November 22nd at 8:30. Enjoy your weekend, everyone.
You too.
You
Thank
too.
you.
All the
Thank you.
best.
Thank
Bye-bye.
you. Thank you.